intense or sudden extreme mood swings, impulsiveness, substance abuse, self-destructive tendencies, threat of suicide, extreme fear of abandonment. These are the possible symptoms of BPD or borderline disorder. BPD is a serious personality disorder which is characterized by chronic unstable emotional control and self-image. In clinical terms, if one has personality disorder, one's pattern of relating to the world is significantly different from the norm. This may cause consistent problems in terms of relationship and career. BPD is often misdiagnosed as bipolar disorder. For the person with bipolar disorder, the mood changes exist for weeks or even months. The mood changes in BPD are much shorter and are often within a day. BPD usually begins during adolescence or early adulthood, but it is rarely diagnosed on its own. Some of the common co-occurring disorders include depression, bipolar disorder, anxiety disorders, and eating disorders. Other than abnormalities in brain structure and function, certain events during childhood involving emotional, physical, and sexual abuse may also play a role in the development of the disorder. According to data from a subsample of participants in a national survey on mental disorders, BPD affects 5.9% of adults, about 14 million Americans, at some time in their life. 80% of people with BPD have suicidal behavior. About 1.6% of adults in the United States have BPD in a given year, and about 4 to 9% commit suicide. However, extreme cases like self-harming behaviors do not stem from a desire to die, but is meant to call for attention. Self-harming behaviors linked with BPD include cutting, burning, hitting, and hair pulling. People with BPD may also self-harm to help regulate their emotions, to punish themselves, or to express their pain. BPD is often treated with psychotherapy or talk therapy in order to reduce the symptoms and improve the patient's lives and relationships. With this method, a psychiatrist and a psychologist can detect BPD based on input from a family or a close friend. That adds to the in-person interview. The treatment involves 1 to 2 sessions in a week with a trusted mental health counselor or therapist. While medication do not cure BPD, according to the United States Food and Drug Administration, people take medications to help reduce symptoms such as anxiety, depression, or aggression, but there's little evidence that this practice is necessary or effective. A person diagnosed with borderline disorder can reduce the symptoms such as mood changes and impulsive behaviors by exercising regularly, eating nutritious diet, and doing healthy stress management.